This is the video on hearing loss. There are 3 different types of hearing loss depending on where the abnormality presents. There is conduction loss from the outer or middle ear, sensory neural loss from the inner ear, and cortical loss from the brain itself. We will look at each one individually. Conduction hearing loss means that the sound is not arriving to the inner ear. This type of hearing loss is typically acquired and can be unilateral. The 3 major causes of this type of hearing loss are acoustical trauma, infection of the middle ear, also known as otitis media, and presbycusis, hearing loss due to old age. However, anything that blocks the sound waves can cause conduction loss, including earwax or beans in your ears. Acoustic trauma can happen quickly or over time. Quick trauma may occur from exposure to explosives or gunfire. Slow routes of trauma can arise from loud noises, industrial equipment, machinery, or amplified musical instruments. These noises can damage over time with a gradual loss of hearing. Conduction loss affects the tympanic membrane, the middle ear bones, or the cochlea. Infections can eat away at the tympanic membrane and the bones of the middle ear. This may distort the sound waves or dampen the effect of the sound waves to produce a vibration large enough to cause movement in the inner ear. Infections can cause a stickiness in the bones, dampening the movement and thereby making the sound less loud. Presbycusis is arthritis that sets up in the bones of the middle ear and is associated with aging. The second type of hearing loss is sensory neural loss. This comes from injury to the inner ear, most commonly the cochlear hair cells or the auditory nerve itself. This raises the threshold for hearing on the affected side. It can be congenital or acquired. Ototic drugs are typically antibiotics such as gentamicin. Here, the damage is to the hair cells with the poisoning of the potassium extruding cells of the outer and inner hair cells. Other causes can be from head trauma or acoustic trauma and viral infections like measles. This type of hearing loss can also be congenital. This last type of hearing loss is cortical in nature. It comes from the brain itself. The cortical area for hearing is in the superior posterior temporal lobe, also known as Brodmann areas 41 and 42. A lesion in this area will cause bilateral or binaural hearing loss. With this type of hearing loss, the middle ear and the inner ear work well. The brain, however, does not process the incoming information. This may be due to a brain injury, a stroke, or a tumor. Hearing aids can help people with conduction hearing loss. The hearing aid amplifies the sound, so the ossicles will vibrate and the sound can be conducted through the rest of the system. For sensory neural hearing loss, a surgically implanted neuroprosthetic device called a cochlear implant can be used. An electrode is passed through the cochlea and is attached to the inside of the skull. An amplifying component called an audio processor is attached to the scalp, and the person can now hear. This obviously requires surgery and is invasive. The sounds that the person hears is very different from normal-sounding voices. There is an extensive training period the person must go through to be able to interpret the new sounds as speech. But once completed, the person can now hear and understand speech. It is a real game changer. For cortical hearing loss, there really is no good way to treat it. This ends the video on types of hearing loss.